It is worrying, the situation that we are living in Middlesbrough. 10% of Middlesbrough population are carers. And the population of Middlesbrough is growing very, very fast. And we have 11%, nearly 12% of the population that is from the BME. This makes Middlesbrough one of the most diverse towns in the Northeast. And we have all heard about the notion of class and the notion of North-South divide, which has also led to us seeing what it's being now classed as a fourth world around the corner of Middlesbrough. Humanah intervention in this project has mainly focused on helping to improve outcomes, experience, and access for BME carers, especially those that we class as hidden carers among BMEs, who are generally not even known by the authority or by services and face multiple disadvantages.
The thing with British culture is that for the last maybe 40, 50 years since the Second World War has been to send our elderly people to care homes rather than look after them in the home. Now that obviously isn't for everybody. A lot of people do look after their elderly. For instance, my partner looked after her mother when she was ill, when she was getting dementia. And we didn't really go to social services to get any support until she became double incontinent, and she needed more nursing rather than just care.
We knew there was a shortfall when it comes down to some of the specific services that are available for carers. So we put in for a specific project I was going to look at reaching out to BME communities with regards to health and social care provision, the support that's provided to those communities, and specifically looking at the issue of carers and hidden carers within BME communities.
The following issues will be discussed in this video: mental health and elderly care, better community engagement with carers and services, developing a more responsive and appropriate services and respite for carers. This video is a result of an intensive research that we conducted in Middlesbrough with BME Carers, with funding from MVDA, which is Middlesbrough Voluntary Development Agency, to Middlesbrough Council. Its purpose is not to tell you about the things that you already know, but we intend to tell you, bring new information that can help shape the space of social care in Middlesbrough.
My name is Nada, and I work as a project worker with my colleague Chris in Humanah CIC.
3 months ago this project started. It was difficult in the very beginning to get it off the ground, but slowly we started to build relationships with different organisations, with my colleague Nada, who speaks different languages, including Arabic. That made it a little bit easier to engage with the people. And slowly we've been introduced, or we've found rather, different BME carers.
I live in Middlesbrough and I'm from Africa. I have one girl. She's 5 years. And that's it.
The way I see it, I'm helping my mum, but when I look at my friends and when I look at how they help their mum, that's when I see how different it is. That's like when it hits me most, that oh, like I'm not just helping her, I'm like looking after her.
My daughter, she's poorly. Mariam, she had the cancer. Mariam, she took 2 chemo course, the chemo not working.
This year has drastically changed the whole outlook of my life, because before I used to live with students, with my own friends, student apartments, but now I live with one of my relatives here in the UK. What happened was really unfortunate, but the lady who I live with, my relative, she was diagnosed with breast cancer. This was a recurrent breast cancer. It wasn't the first time. The first time ever she was diagnosed was 2 years ago. This was recurrent, which made it more difficult. We were never expecting this.
All the kids need help, but when somebody's more poorly, they need extra care. Like, for example, my son now. I won't go anywhere and leave him on his own.
How many children do you have?
I've got 4 children.
Caring for my friend, his name is Husham. Yeah, he had an injury. He was playing football, and he had an injury. He doesn't know anyone here, you know. He doesn't know any place. He doesn't know anything. And he doesn't speak English as well. So I helped him, you know, about everything.
There's lots of people who are hidden in the system, who need care, who are not recognised as needing that care, and we think they should. It is a human right to have care services provided, and I think in a rich Western country we should be able to afford to pay for that.
Throughout the 3 months, myself and Nada have adopted different research methodologies to help us with the project. Initially, we devised a set of questions, or a questionnaire, which was distributed to various places in the community, what we thought were good places where BME community might go. These questions were carefully crafted based on what knowledge we already knew and from what we've researched prior to starting the project. And you know, the initial idea of the questionnaire was just to find out specifically, you know, more in detail the problems what individuals are facing. Interestingly, the respondents from the questionnaires said that, you know, they found it difficult to access support mechanisms because of linguistic and cultural barriers. There was a lack of understanding of the care system in the UK.
I didn't know what to do, but they came one day to talk about the houses, and she asked me, is anybody in the house disabled or anything? I said, my son has got this problem. I explained everything, and I've got this problem. She said, you should be entitled to some mobility. I said, well, I don't know how to do it. She said, we'll help you with that, fill in that form, which they did. The answer, a doctor came to see me at home, and they said, I'm not entitled to it. Then the second time, I filled the form as well because I went job seekers allowance. I had a meeting with them, and I explained everything again, what I've got and what my son's got. And she said to me that day, that's enough and more from enough for you. You should fill a form and you should be entitled to something.
The notion of culture and identity within BME community is very important. Because each community have its own way and set values to express themselves and to talk about things that are important to them. And BME Carer, through this project, helped Humanah to build a strong sense of service that have encouraged participation, which we believe could be used as an added value to improving social care for BME in Middlesbrough.
We help them get a carer support plan, which can help them get entitled to respite care and also an emergency card. They've also now got access to the life store where they've got a bottle. So in an emergency, because language is a barrier, they'll have the person that they look after their medication. So if the ambulance do come, they're aware of what the condition of the person is, which can also help with barriers of language.
We spoke to a number of BME carers who have told us that they have difficulties around access, support, information that can be understood, whether in their language or in a way that can be easily digested for them.
I didn't know nothing about carer or disability, I don't know what they call it, because I've got a problem with my knees, I can't walk. They need replacing knees, and they won't do that because I'm still young. One, I found out the problem with my son, because I was going nearly 3 times a week to the hospital. They could send me in and out because there's no bed, and it cost me in one day £20 for the taxis. And I mentioned it to the nurse who comes to help me, and she said he should be entitled to something like for transport.
We've had a number of cases over the years where people have needed medical help, they need care at home, and it's very, very difficult to get that care in place. I was speaking to one of my workers just a while ago, and she was saying that there was a guy who has a mental health issue, and he's very confused. He's a very nice guy, always very happy, but he can't really look after himself. And he was assessed by social services, and they decided that he didn't need any care needs.
For carers, there's a number of different services that are there for support, and it really boils down to a case-by-case service. Although there are services there, what we need to recognise is that some of those services may not be as culturally sensitive. So if you're looking at a carer support group, and if your first language is in English, then the issue of a carer support being available is fine, but if that is not accessible because of a language issue or some sort of cultural issue, then really this is where we need to have a discussion with those providers and say, well, how do we assist you to develop those services so they are much more accessible, or if, for example, the carer support groups are not gender-based, and we may be working, for example, with some communities where, for example, they want a same gender carer support group, then we would need to look at issues around that, because ultimately a carer support group needs to support the carers, and what we don't want to do is alienate carers by virtue of the systems that we set up that are actually meant to support them.
If my mum did get support, then that would mean that I would be able to go to university without having any guiltiness feeling on my mind, and I would be able to get a job, and I know that if I'm at work, my mum's all right, she's fine, and I can go home and see her and everything will be okay.
We did think of, well, not just think, we did approach the NHS saying, can we have a nurse, a day nurse? Because, this is how it is happening, and I need to come for my classes at university. It's spread out from 9 a.m. till 5 p.m. So on Mondays, I need to come at 9 o'clock. On Tuesdays, I'm here till 5 o'clock. So it's really spread out. If I'm not going to university, obviously I'm there, with her doing my work and all that without any much of concentration. But anyways, because of that, we did approach NHS and we did say, can we have a nurse?
We do sometimes wonder whether social services are more interested in protecting their budgets, ever decreasing budgets, because we're in a time of austerity. They haven't got the resources, they haven't got the funds, there's cuts being made everywhere. And it's almost as if the assessment is to try to avoid supporting people.
But they directly said no. We couldn't. We cannot make it because of so and so and so. To be honest, they didn't even give us a valid reason. They just said it's not possible.
Humanah has been working intensively with groups such as refugees, asylum seekers, international students, EU migrants, and also spouse of British citizens or EU citizens who arrive in the UK and have a lot of immigration boundaries around the way they live their lives. And sometimes these populations are the worst affected when it comes to social care services.
Another part of my job to find and recruit BME carers as well as non-carers into different social activities such as swimming, cookery and gym, and also basic ICT, ESOL, and citizen advice.
In our organization, we receive a lot of young people who have serious caring responsibility at home, which cause intensive emotional problems to these young people.
But when you're caring for your relatives, there are certain things they might say, or their mood swing. It might hurt. It hurts as well sometimes. And then you don't know how to deal with it, because I am not really a qualified carer. I've not studied caring. Sometimes I might retort, I might answer back, which is not really good for the patient, because I have to be really patient. I have to be really have that patience in order to deal with the patient.
For me, it would be nice to know if there were other people out there that were like in the same position as me. It would be nice to know, like, what do they do when they feel like there's no hope.
Although they might have seen leaflets that explained, for example, carers groups or carers forums, some older respondents who might be illiterate and therefore were unable to to read the leaflets. So all of these issues were found from the questionnaires. In addition to the fact that taking on the role as a carer is not easy by any means. It's tiresome, it's draining. It also affects your own personal health.
My education is extremely affected, very, very much. My grades have not come out yet. The assignment that I did, it was just last hour. I had to submit it at 3 o'clock, and I just submitted at 2 o'clock 58 minutes. There was just 2 minutes to deadline. I submitted. So all that stress issues. I'm suffering from stress at the moment, and all the anxiety things. So yes, the education extremely affected, plus my health is affected as well.
And this was reflected in the questionnaires, in the sense that people identified that they would like some respite time or time off from caring, whether that was to be take up hobbies, what they were interested in, and also Humanah itself runs a lot of community courses. Myself, I run a citizenship, global issues course, ESOL, and also basic ICT. So this was very clear from the questionnaires that carers were wanting some activities to do, to get engaged with, to be involved with. Also, shopping, day trips, shopping, gym, exercise. All of these were other activities that were mentioned from the questionnaires.
We took that on board and we decided to provide it for them. And in the past 3 months, since January 2013, we have worked intensively to acquire a list for Middlesbrough Council to open a new centre for care where they can go and just do what they have told us they would do.
Thank you for all coming, right? And I want to just tell you about, this is our shop, this is the Humanah shop. This is not like just for Humanah, it's for the community, like the Middlesbrough community as well. So it's open for other people, like if they want to come and do like workshops in here, like deliver it to women, to men, to young kids, they can use this place.
In this project, we have also looked at the need of BME pensioner. We have looked at the general BME population, and we have see the problems that can come in the future. Therefore, we spoke to a number of people from the BME communities who are likely to become pensioners in this country to find out what they think, how they foresee the future for themselves.
There's all sorts of aspects to this, and I think that in the future we will find that more BME communities will need support when they get older. But it doesn't necessarily mean that their siblings won't look after them. It doesn't mean that their children won't look after them and support them. But I think, you know, we all need to earn money, we all have careers, and it's important that we actually get support from social services and recognition of the additional work you're providing. Because care homes are very expensive, and it's much cheaper to keep people at home if there's somebody who can look after them. But they do need that additional support to do that.
Ooh, I don't know if I've thought about it as 30 years down the line, but I hope that I'll retire here and continue to live my old age here, comfortable, hopefully.
I don't plan to live here for the rest of my life. Environmentally speaking about the weather, because here is very cold and in my country it's warm, and every single winter I get sick. So yes, but this is the country that I came. Yeah, one day.
I'm not sure how that will plan out, but you know, be able to buy things, not think about where the money is coming from. Maybe someone to look after me, I don't know. So we don't know what, how my health will be by then. So yes, I think it's something I probably have to give more thought to now we're talking about it. So yes, I hope it's going to be good.
I don't know yet because I'm not old. But from people's experiences, yes, lots of people from our community who are older, they say that the way the country it is, the way the social life, social fare, all the cuts, privatization of everything, yeah, is getting difficult from them. So yes, maybe this will be one of the reasons why. And also because of family. We are here on our own. Of course, we have other community members, but there is nothing like real family. Yeah.
For better and alternative services to be developed and respond to the needs of BME carers, we think that collaboration is what most BME carers think should be prioritized. Agency need to work intensively with grassroots community organizations, engage with them, support them to look after each other, because at grassroots level, the knowledge that people have at that level is very, very valuable, and organizations need to be well aware of these grassroots knowledge to build their own evidence, to create new services that respond to the need of BME.